Anish, Wadhwa. Welcome back.
Good morning. Thanks for having me.
Yeah, thanks for being here today.
Yeah, nice to have you here because what you deal with, so many in our population could use your help,
Yeah.
particularly when it comes to sleep apnea.
Oh yeah.
And I'm hearing a lot of news about new techniques, new devices, new strategies for dealing with sleep apnea.
Yeah, thanks for having me. I think just like every chronic condition, if you don't look for it, you don't know if you have it. And so a lot of this starts with people relying on their doctor to say, hey, what are my chronic conditions? I think I've talked about this before. You have to have a good relationship with somebody you trust. Sleep apnea is a condition essentially when there's not good airflow when people sleep, and it leads to interruption and efficiency of sleep. So the inefficiency of sleep means that people might wake up tired, and if they have chronic conditions like diabetes and high blood pressure, it can antagonize the outcome. So if you have not great blood pressure and you have sleep apnea that's untreated, maybe your blood pressure doesn't get much better, even if you take medicines, or there's a risk associated with it. So I think I was reading perhaps 80% of people in this country might be undiagnosed.
Oh my gosh.
We're talking about significant effects in terms of workplace cost, in terms of missed days of work, maybe $100 billion or more. And I think this was data maybe from the American Academy of Sleep Medicine. So there's good data to say that this is an undertreated problem. We don't look enough for it, and there might be some easy ways to look and then potentially treat this.
I think when people, well, at least when I think of sleep apnea, I just think of like, I don't know, trouble breathing and congestion and things like that. But there's stuff going on in your lungs really that's causing that, or can be.
Yeah, there are many factors that can contribute to not great breathing when you sleep. And for some people, we think about this as a consequence of obesity. That's certainly common, but there are people who have lower BMI who can have disordered breathing, sleep disordered breathing. And so it's important to find the right people to screen. Screening tests should find the diagnosis if it's there. And so some simple testing can find it in the right person. And then you can say, well, in the context of that person, does it need to be treated? It's kind of like a stepwise thing.
So really, like, who should be screened?
Yeah, how do you know? What are the symptoms?
So people who, there's actually some good screening tools that primary doctors use in their clinics, and these focus on questions like snoring, or people if they have observed apneas. If people are tired, there are many reasons to be tired. If you have bad sleep habits, you're going to be tired regardless of sleep apnea. A couple other things in terms of your age, what your body mass index is, how large your neck circumference is. These are the kind of things that might be used to say, who do I start screening?
Interesting.
I bet there's a lot of people that don't want to get screened because they don't want to be saddled with that CPAP device.
Yeah. CPAP refers to continuous positive airway pressure, and you're right, the concept is going to be the same regardless of what type of thing you choose. If you have enough airflow interruption, it's something here. Now, there are a lot of options. Over the years, I've been working here in Jackson for 10 years, and sleep treatment has been going on for decades. The concept is roughly the same. There's something here pushing air in to keep your airway open. A hose connects to a machine next to your bed. The thing is there are many options that might work for people. And for many people, anecdotally, they don't know they're going to tolerate it unless they try it.
Right.
And I give people the same comparison. This is a non-invasive thing. It's maybe annoying to get a test or annoying to try it. If you don't like it, you don't like it. Right? There's not a long-term consequence except for the time and effort you put in with your doctor to say, is this right for me, yes or no? Many people will find that the quality of their sleep, I've had patients say, I've never had a dream. Maybe for 20 or 30 years, I haven't had a dream. And the quality of my sleep has improved. And that doesn't even get to the bed partner who says, hey, I'm not having to nudge them all night to make sure they're alive.
Yeah.
Is dreaming a symptom of sleep apnea?
Let's put it this way: if you have poor quality sleep, then the potential that you're having good deep sleep or dreaming might occur.
Sure.
I think there's probably some connection in that way.
Interesting.
So dreaming is good or bad?
Depth of sleep is good, and probably you'll have a dream. Although I would suggest, not everybody who has sleep apnea, doesn't dream.
Sure.
But really, it's the quality of the sleep that you're trying to improve, and then for those people, address the physiologic problem.
Yeah.
I think dreaming is taxing when you're sleeping. I was
You have
the other
nightmares,
night,
that's
I
why
was
I was
dreaming
fair.
we're in a room. I had family members, my sister were watching TV, and someone's turning the channel. So in my dream, I'm creating the scenario and the conversations in the room and everything that's on all the channels that they're flipping through.
Should we get him he needs another doctor.
Well, I think this gets to the point that good quality sleep is a product of a lot of things. And this can be done in primary clinics where they screen people and start therapy. But there is some nuance to it. And sometimes you do need to see a sleep specialist to say, is this enough? There are other conditions that can manifest that will complicate your sleep quality, maybe even when you get to deep sleep.
What's the Inspire device I've been hearing about?
You mentioned CPAP. That's the tried and true gold standard. And so the concept of pushing air, some measure to keep your airway open. But for those patients who are not tolerant to CPAP and who have a certain amount of severity, there are alternatives. And for some people, just even losing weight might be enough, or you sleep on your side. Sometimes they'll see their dentist and get an oral appliance. For those folks who have at least moderate sleep apnea, based on whatever criteria are, for those patients, if they're not tolerant to CPAP and they need to get treatment, especially if they have high blood pressure, stroke, diabetes, for those patients, there's a surgical procedure. It's an implantable device. Let's say it's somewhat akin to a pacemaker. You have to go through a series of steps in terms of an evaluation. Not everybody is right for this. But if it's a right thing to consider, we send those folks to one of the surgeons here locally, Dr. Ali. He's an ear, nose, and throat surgeon. He's been trained to do this procedure. He and his team will take the referral, they'll screen the patient, they'll work with the referring doctor. Typically we'll see them in clinic because they're probably not tolerating their CPAP. You go through a series of steps, including an evaluation to say, are you anatomically correct for this? And then sometimes this is an alternative for those patients who need treatment but can't tolerate CPAP. So it's not a one step to the next step. There's a few steps in between. But for some patients, this is a new option.
It's amazing, something all humans require every single day, and there's ways to improve it. So get checked out for sure. I think you need a sleep study, Bart.
Not if they're going to ask me if I'm anatomically correct.
One thing I would suggest is this is, again, something to talk about with the doctor.
Yeah.
We have a good staff in our clinic. We work closely with the ENT clinic about getting these patients screened and then referred. Heather, the scheduler in our office, Tim, the sleep technician, they're nice people. They'll talk to you, and you have to have a consultation, and then we have to get a test, and then it's really it's about finding what's there and starting therapy and talking about what's right for everybody, because it's not cookie cutter. Not everybody gets the same thing.
I think I'll do it.
I think you should.
And then once you do, and it's like you're starting a path that there's no turning back, right?
Well, I think, let's say, you have the potential to lose weight, and maybe your sleep apnea might improve with weight loss. So this is not a fixed, you're stuck with it kind of thing. It's a dynamic thing. For people who are on CPAP or BiPAP or other methods of treating sleep apnea, they need follow-up. And so typically we see them annually. I think it's a question of saying, start with something, find out if it's right for you, and then go from there and say, hey, what do we do next? For many people, they will wear this for years and years.
Great. Well, we always appreciate all your expertise and your time. Thanks for coming in today.
Thank you. Thanks for talking about this topic.
Dr. Anish Wadhwa from Pulmonary Clinics of Southern Michigan. More of the morning show after this.